Right. So if you have read and understood, considering its surgical pathology station, kindly please tell me what would be your differential diagnosis?
My differentials will be familial adenomatous polyposis,
Yes.
ulcerative colitis,
Okay.
uh,
And
and carcinoma colon.
yes. Okay, good. Right. Since the patient is young and the colonoscopy which was done, it revealed multiple polyps, and the largest one was 7 millimeter, and it was ulcerated. So, what would you say to this patient, especially when she has a strong family history of CA colon as well?
I like to inform the patient that she is having multiple polyps, and because she is already having a family history, there is a high risk that she may develop like carcinoma colon by the age of 40 years. Hence,
Your
she
voice
may
is not
need.
clear. I can't understand what you're saying. Okay.
Okay, ma'am. Ma'am, can you
Right.
hear me now?
Yes, it's better. Can you please tell me, since she has a strong family history, so what are the genes which are likely to be transferred from her father to her?
Most likely APC gene mutation,
Yes.
KRAS, and P53.
Okay. These are the likely ones. Okay. That largest polyp is ulcerated. What do you understand by the term ulcer?
Ulcer is the loss of continuity of epithelium lining the skin or mucosa due to the death of tissue.
Okay, good. Right. Can you tell me, okay, what would be your next management or next step of
I would
management? Yes.
I would like to offer her near total colectomy at age 25 years.
Sorry, what would you offer her?
Near total colectomy by age of
Okay.
25 years, ma'am.
Yes. Okay. What is the procedure of or what is the clinical what is it called? I've forgotten the word. Okay, I'll remember. When you have to do the follow-up as
Surveillance, ma'am.
surveillance, sorry. Yes. How frequently it should be done?
If there is a high risk
Yes,
or post
just
family
like in
history,
this
then
one.
we
Yes.
have to do yearly follow-up from the age of 12 years, ma'am.
Okay, good. All right. Okay. Can you please tell me, yes, because of the risk of colons, all right. Could there be any, what is the most commonly occurring carcinoma of colon?
Ma'am, adenocarcinoma.
Adenocarcinoma. Okay. How the adenocarcinoma can be categorized or can be differentiated or can be when you have to rule it out the degree or the grades of malignancy. So how would you label it or how would you categorize it?
Ma'am, we have to look for the adenoma size,
Yes.
number, histology of the adenoma, and type of adenoma.
Yes. Actually, I wanted to hear about the Duke classification. Like you have to categorize
Oh,
it.
okay, ma'am.
Yes.
Yeah, as we can, as per the Duke's criteria, Duke A is involvement of the skin or submucosa, and Duke B1 is involvement of the muscularis propria, and B2 is involvement of the serosa and beyond, and
Yes.
C1 is 1 to 4 lymph nodes, and C2 is more than 4 lymph nodes, and D is distant metastasis.
Okay. How would you compare the Duke's classification with TNM classification?
In TNM classification, T1 is involvement of mucosa, T2 is involvement of muscularis layer, and T3 is involvement of subserosa, and T4 is beyond the serosa local invasion, and N1 is 1 to 4, and N2 is more than 4 lymph nodes, and N3 is distant nodal metastasis, and M0 is no metastasis, and M1 is distant metastasis.
Okay. Since this patient is also a known case of endometriosis, what do you know about this condition?
Endometriosis is presence of ectopic endometrial tissue outside the uterus.
All right. Why a patient experiences pain in this condition?
In endometriosis, as the endometrial tissue is outside the uterus, and whenever the hormonal stimulation occurs,
Yes.
the tissue will proliferate and sheds. As a result of which, there will be local bleeding, which can cause a local inflammation of the tissues, as well as adhesions, which can cause pain.
Do you know if there is any direct linkage between endometriosis and CA colon?
I will come back to that question later.
Okay, or if any other type of malignancies it's associated. All right.
Yes, it is associated with ovarian
Mhm.
cancer and
Yes.
non-Hodgkin's lymphoma.
Yes. Okay, good. So you knew the answer. All right. Can you tell me how many? Okay, this is the largest polyp is 7 millimeter. What could be the range of size of the polyps if you suspect CA colon?
If the size of the polyp is less than 1 centimeter, it can be 5%, but if it is more than 2 centimeter, there is a 20% risk of development of colon cancer.
Okay. If we can little bit talk about the genes, if you tell me what is the function of the APC gene?
APC gene is a gene present in the long arm of chromosome number 5. It is it is a part of WNT signal pathway, which transmits the signals from outside nucleus cell to the nucleus. Whenever there is a mutation, the normal function of disintegration of beta catenin won't happen, as a result of which the beta catenin can accumulate and cause constant stimulation of WNT pathway, thereby causing dysplasia and abnormal cell proliferation.
Good. What is dysplasia?
Dysplasia is disorganized cell growth characterized by increased mitosis, pleomorphism, and increased nuclear cytoplasmic ratio.
Good. Can you please suggest what lifestyle changes would you advise to this patient in order to reduce the risk of CA colon?
I would advise the patient to avoid smoking
Yes.
and alcohol intake,
Yes.
take fruits and vegetables, and a low fatty diet,
Yes.
and also have a good exercise program.
And high fiber diet.
High fiber.
Okay. Since this patient is has ulcer, so how does a ulcer heals?
Ulcer heals by reepithelialization. Ma'am. I'm not sure. I will come back to that question later.
Yes. What do you understand by the term secondary intention?
Secondary intention is a way of healing where there will be
Yes.
fibrosis and
Whenever primary primary healing intention is not possible, so what happens in this condition?
there will be reepithelialization and contraction of the tissues.
Okay. And
And
there's
scar
more.
formation.
Yes. And then there's more granulation and more when there is more tissue damage and primary healing is not possible, then it will heal by the second intention. So yes,
Okay,
your
ma'am.
point is clear that there'll be more granulation and scar will be bigger. Can you give few
Okay.
examples of secondary intention, healing by secondary intention?
Infected surgical wound,
All right. Okay.
non-sutured non-sutured lacerated wound.
Okay.
Mm,
And burns maybe when they heal
burns.
by
Oh,
secondary intention. Yeah.
yes, ma'am. Burns.
Fractures when they are not healing, or their healing is poor.
Yes, ma'am.
Then yes, yes, mostly you've told me pressure or bed sores, pressure sores or bed sores. If a patient
Okay, ma'am.
encounters, then they also heal by secondary intention. Good.
Okay.
Good. Thank you. Can you describe the image you are looking at, please?
Yes, ma'am. This is a colonoscopy picture showing multiple adenomas
Yes. And
some amount of bile.
yes, very good. And what is this glistening? Glistening is because of the bile present, this yellow splash of bile. Yes. And then what are these?
These are polyps, no?
Polyps of various sizes, you have to tell me.
Polyps of various. Okay, my
Yes.
polyps of various sizes.
Yes. And also, yes. Can you see any ulcerated one?
Uh,
Maybe not.
I'm not sure.
Yes, not sure, but they are definitely of various sizes, right? So you can
Yes,
say
ma'am.
in
Yes, ma'am.
various sizes and maybe in different stages of condition, disease condition as well, because if they are not ulcerated at the moment, but the condition is of different stages, not of the same stage in all of the polyps. Okay, good.
Okay, ma'am. Okay.
Right. Thank you.
Thank you.